Hepatitis is a medical condition that refers to the inflammation of the liver. It can be caused by a variety of factors, including viral infections, alcohol consumption, and autoimmune diseases. The most common types of viral hepatitis are hepatitis A, B, and C. Hepatitis A is typically spread through contaminated food or water, while hepatitis B and C are spread through blood or other bodily fluids. Hepatitis B and C can lead to chronic infections and long-term liver damage, and they are often asymptomatic in the early stages. Symptoms of hepatitis can include fatigue, nausea, abdominal pain, jaundice, and fever. In severe cases, hepatitis can lead to liver failure and even death. Treatment options for hepatitis vary depending on the type and severity of the infection, but may include antiviral medications, lifestyle changes, and in some cases, liver transplantation. Prevention is key when it comes to hepatitis, and there are a number of steps individuals can take to reduce their risk of infection. These include practicing good hygiene, getting vaccinated for hepatitis A and B, avoiding risky behaviors such as sharing needles or having unprotected sex, and limiting alcohol consumption. Overall, hepatitis is a serious medical condition that can have significant long-term consequences. It is important for individuals to be aware of the risk factors and symptoms of hepatitis, and to take steps to prevent infection whenever possible. Hepatitis is a medical condition that is characterized by inflammation of the liver. It is caused by a viral infection or exposure to harmful substances such as alcohol, drugs, and toxins. There are several types of hepatitis, including hepatitis A, B, C, D, and E, each with its unique causes and symptoms. Hepatitis A is caused by the hepatitis A virus, which is transmitted through contaminated food or water. Poor sanitation and hygiene practices can also contribute to the spread of the virus. Symptoms of hepatitis A include fatigue, nausea, vomiting, abdominal pain, and jaundice. Hepatitis B is caused by the hepatitis B virus, HBV, which is transmitted through blood, semen, or other bodily fluids. The virus can be spread through unprotected sex, sharing needles, or from mother to child during childbirth. Symptoms of hepatitis B include fatigue, fever, abdominal pain, and jaundice. Hepatitis C is caused by the hepatitis C virus, HCV, which is transmitted through blood-to-blood contact. The virus can be spread through sharing needles, receiving blood transfusions or organ transplants before 1992, or from mother to child during childbirth. Symptoms of hepatitis C include fatigue, joint pain, abdominal pain, and jaundice. Hepatitis D is caused by the hepatitis D virus, HDV, which only affects people who are already infected with hepatitis B. The virus is transmitted through blood-to-blood contact and can worsen the symptoms of hepatitis B. Hepatitis E is caused by the hepatitis E virus, HEV, which is transmitted through contaminated food or water. The virus is more common in developing countries and can cause symptoms similar to hepatitis A. In addition to viral infections, hepatitis can also be caused by exposure to harmful substances such as alcohol, drugs, and toxins. Excessive alcohol consumption can lead to alcoholic hepatitis, which can cause liver damage and inflammation. Drug-induced hepatitis can be caused by prescription drugs, over-the-counter medications, or illegal drugs. Exposure to toxins such as chemicals, pesticides, and industrial solvents can also cause hepatitis. In conclusion, hepatitis is a medical condition that can be caused by viral infections or exposure to harmful substances. is important to take preventive measures to avoid contracting the virus and to seek medical attention if you experience symptoms of hepatitis. Sure, here's a script about 5 good foods for hepatitis. 1. Leafy greens. Leafy greens such as kale, spinach, and collard greens are rich in antioxidants, vitamins, and minerals that help to support liver function. They are also high in fiber, which helps to promote healthy digestion and reduce inflammation in the body. 2. Garlic. Garlic contains compounds that help to stimulate liver function and reduce inflammation in the body. It also has antiviral properties that can help to fight off infections, including those that may be associated with hepatitis. 3. Turmeric. Turmeric is a spice that contains a compound called curcumin, which has been shown to have anti-inflammatory and antioxidant properties. It can help to reduce inflammation in the liver and may also help to protect against liver damage. 4. Berries. Berries such as blueberries, raspberries, and strawberries are high in antioxidants, which help to protect the liver from damage. They also contain fiber, which helps to promote healthy digestion and reduce inflammation in the body. 5. Fatty fish. Fatty fish such as salmon, mackerel, and sardines are high in omega-3 fatty acids, which help to reduce inflammation in the body and support liver function. They also contain vitamin D, which is important for overall health. Overall, incorporating these foods into your diet can help to support liver function and reduce inflammation in the body, which may be beneficial for those with hepatitis. 1. Fried foods. Fried foods are high in fat and calories, which can lead to weight gain and increase the risk of liver damage. Additionally, the high heat used in frying can produce harmful compounds that can damage the liver. 2. Alcohol. Alcohol is a known liver toxin and can cause inflammation and damage to the liver. It is important for individuals with hepatitis to avoid alcohol completely to prevent further liver damage. 3. Processed foods. Processed foods are often high in sodium, sugar, and unhealthy fats, which can contribute to inflammation and damage to the liver. It is important to choose whole, unprocessed foods to support liver health. 4. High sugar foods. Foods high in sugar can cause inflammation and damage to the liver. It is important to limit intake of sugary drinks, desserts, and processed foods to support liver health. 5. Red meat. Red meat is high in saturated fat, which can contribute to inflammation and damage to the liver. It is important to choose lean protein sources such as fish, poultry, and plant-based proteins to support liver health. Hepatitis is a viral infection that affects the liver and can cause serious health problems. However, there are several ways to prevent getting hepatitis. Here are some specific steps you can take to protect yourself. 1. Get vaccinated. Hepatitis A and B can be prevented through vaccination. It is recommended that all children receive the hepatitis A and B vaccine, and adults who are at risk of contracting the virus should also get vaccinated. 2. Practice good hygiene. Hepatitis A and E are spread through contaminated food and water. Therefore, it is important to practice good hygiene by washing your hands thoroughly with soap and water before eating or preparing food, and drinking clean water. 3. Practice safe sex. Hepatitis B and C can be transmitted through sexual contact with an infected person. Using condoms during sex can help reduce the risk of transmission. 4. Avoid sharing needles. Hepatitis B and C can also be transmitted through sharing needles or other injection equipment. If you use drugs, it is important to use clean needles and not share them with others. 5. Be careful when getting tattoos or piercings. Hepatitis B and C can also be transmitted through contaminated needles during tattooing or piercing. Make sure the facility you choose uses sterile equipment and follows proper hygiene practices. 6. Be cautious when traveling. Hepatitis A and E are more common in developing countries with poor sanitation. If you are traveling to these areas, make sure to drink bottled water, avoid raw or undercooked food, and practice good hygiene. By taking these steps, you can significantly reduce your risk of contracting hepatitis. It is important to remember that prevention is key, and taking these precautions can help keep you healthy and safe. Hepatitis is a viral infection that affects the liver. There are several types of hepatitis, including A, B, C, D, and E. Each type of hepatitis is caused by a different virus and requires a different treatment approach. Here are some ways to cure hepatitis. 1. Antiviral medications. Antiviral medications are the primary treatment for hepatitis B and C. These medications work by stopping the virus from multiplying in the body. The length of treatment varies depending on the type of hepatitis and the severity of the infection. 2. Interferon therapy. Interferon therapy is a type of treatment that helps boost the immune system to fight off the virus. It is used to treat hepatitis B and C. Interferon therapy is given as an injection and can have side effects such as flu-like symptoms. 3. Liver transplant. In severe cases of hepatitis, a liver transplant may be necessary. This is a surgical procedure where a diseased liver is replaced with a healthy liver from a donor. 4. Lifestyle changes. Making lifestyle changes can help manage the symptoms of hepatitis and prevent further liver damage. This includes avoiding alcohol, eating a healthy diet, and getting regular exercise. 5. Vaccinations. Vaccinations are available for hepatitis A and B. Getting vaccinated can help prevent the spread of the virus and protect against future infections. 6. Alternative therapies. Some people with hepatitis may choose to try alternative therapies such as herbal supplements or acupuncture. However, there is limited scientific evidence to support the effectiveness of these treatments. It is important to consult with a healthcare provider to determine the best treatment approach for your specific type of hepatitis. With proper treatment and management, many people with hepatitis can live healthy and productive lives. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.